Hey guys, I'm going to run down just a quick little list with you guys, and this is secrets your dentists don't want you to know. I don't really think that they're secrets, but I think that they're it brings up a few important things. I'm going to just run through most of them, but a couple of them I have a few comments on. One is your dentist may not be as educated as you think. Always look into what kind of education your dentist has. You can always look that up through the ADA or whatever, but just make sure that they're qualified. I know in certain states there are dentists that have actually had their license taken away that are still practicing. So it's kind of important to make sure that your dentist has the education or at least the credentials to do the work that you're asking them to do. Number two is making sure that they have the latest technology. Now, I understand not every dentist can be completely up to date with the latest robots, but you can make sure that they're doing the right things based on what's best for the patients, like digital x-rays, ultrasonic cleaning, things like that. There's a laser, I think it's called Diagent or something, but basically it shines a light in the tooth and it tells them where the cavity is and how deep it goes and stuff. So there's some pretty cool stuff out there, but not every dentist office has it. Basically, just make sure that they're at least keeping up with things and they're not using 1940s technology, which isn't very good. Number three is that they might be using mercury. There are dentists out there that are still using mercury, so you want to make sure that they're using a composite base when they're doing fillings and things like that. So just make sure that they actually are up to date on those regulations. That's really important. Number four, the lab may be more important than your dentist, and that's true. If they send your stuff out to a lab, you want to make sure that you check into which lab that they're using, because some labs use materials from China or Mexico. Those are the biggest offenders when it comes to stuff that's not approved by the FDA. So you just want to make sure that the labs are using stuff that is approved, that they're not using, I'm trying to see where it says it here, but in order to increase profit, some dentists use foreign labs or cut rate domestic ones. These labs may include tin, aluminum, or even lead in their restorations. A reputable first-class lab will certify its restorations contain none of those metals and provide the dentist and patients a warranty on their craftsmanship. Good questions to ask. If you don't know where or which lab your dentist is using, you need to find out. Number five, there's more to good dentistry than filling cavities, and that's really important. And here's why. A competent dentist screens for more than just tooth decay. He or she should be concerned about sleep apnea, jaw-related pain known as TMJ, periodontal disease, oral cancer, diabetes, hypertension. Sleep apnea is a really big thing. Asking simple questions about snoring, weight gain, or medication such as blood pressure, acid reflux drugs can give your dentist clues about sleep apnea. TMJ, periodontal disease, hypertension. Cancer screening. A lot of dentists offer cancer screening. That's a really good thing. They should be inspecting your mouth for lesions or signs of that kind of stuff. So a good dentist office should offer you that. If your dentist isn't doing these things, find out who does and go to them. It's good to ask these questions. Number six, you're probably using the wrong specialist for your dental implants. I've seen this a lot actually lately when I was looking at reviews. Since dental implants involve the removal of a tooth and placing it with an artificial tooth, many patients assume that an oral surgeon is best qualified to do so. This can be a flawed assumption. I'm reading. Periodontists who specialize in gum disease may be a better option. Periodontists have special training in gum tissue and underlying bone in the mouth. When you use your general dentist, a periodontist, or an oral surgeon, you should ask these questions. What is your success rate with implants? It should be at least 94%. Okay. How long is the procedure? It should be no more than 30 minutes. Do you use a surgical guide? A surgical guide directs the implant drilling system and provides for accurate placement according to the digital surgical treatment plan. It's important to confirm that the dentist doing your implant uses a surgical guide. Do you use a CT scan and 3D imaging software? The technology assesses bone structure and identifies the best sites for dental implant placement while avoiding vital structures like nerves. That's really important. Many dentists hold themselves out as implant specialists. You need to screen them very carefully before entrusting them with this surgical procedure. That is so true. Make sure that your dentist isn't just claiming they can do implants. Make sure that they can provide you with some sort of proof, or at least patients that have had a successful implant through them, and not just one patient, but several. Number 7, bad dental advice about dentures can be fatal. And that's true. I wholeheartedly believe that. And it's not just senior citizens that are getting dentures anymore. While patients often pride themselves on keeping the same dentures for many years, this can be a big mistake. Your dentist should examine your dentures for evidence of wear. Wearing down the teeth on your dentures can result in distorted facial characteristics, collapse of the bite, and closure of the airway. Dentures need to be replaced at least once every 5 to 7 years. Poor fit or worn dentures can cause sleep apnea, stroke, or even death. Yearly cancer screening exams of denture users are extremely important. Contrary to common perception, dentures should be worn at night in order to ensure that the airway passage is kept open. Your dentist should instruct you on proper denture cleaning and should check you regularly for signs of infection. If you guys can see that where it says contrary to common perception. It's right there. I've seen a lot of really weird dental advice or denture advice, and you know, it's really interesting because it just depends. I mean, it doesn't matter who it comes from. It's still somebody's opinion, whether it's an expert opinion, a professional opinion, a personal opinion. It's just an opinion. It's not evidence. There is no evidence. There's no scientific evidence out there. Believe me, I've been searching. It's not there. There's no positive scientific evidence. And asking your dentist or your denturist or your prosthodontist, that's just getting their opinion. It's not evidence. It's just an opinion. So I can ask several dentists what they think, and they're going to give me their professional opinion. But it's not evidence. Just saying. Number 8, your dentist may not know enough about sleep apnea. Sleep apnea is getting to be a really big thing lately, and I thought it used to just be on kind of a smaller case by case. My ex-husband had sleep apnea really bad. He was in the Navy. I don't exactly know what happened, but ever since he was in the Navy, he developed sleep apnea, and finally took him to get a sleep study done, and he ended up walking out with a CPAP machine. It was really bad. I mean, he'd have full-on spasms, stop breathing in the middle of the night. It was scary. So sleep apnea is really important to make sure that you get the right assessment for it. If you're really tired during the day, even though you think you got 8 hours of sleep, or you wake up, you know, startled in the middle of the night, things like that, or your partner tells you you snore a lot, you might want to get that checked out. The most common form of sleep apnea is caused by blockage of the airway during sleep. It's a really scary condition if it's, you know, if it's bad. They can stop breathing hundreds of times during the night. Common treatment for sleep apnea is a CPAP machine, which blows pressurized air into your nostrils to keep the airway open. There's other different types. There's devices that are implants. There's devices that just go over your nose. There's ones that go in your mouth. There's all different types of treatment for it. But your dentist should at least be asking you questions about it. One of the questions is, if you think you have sleep apnea and you want to ask your dentist about it, are you a member of the American Academy of Dental Sleep Medicine? Do you regularly attend the annual meeting of the Academy? Do you work with ear, nose, and throat physicians and sleep physicians when appropriate? You can also call sleep centers and ask them what dentist they prefer to use in your area. Sleep apnea is potentially a very serious medical condition. It is important to do careful due diligence before you select a dentist to treat it. Very true. Not all cosmetic dentists have the skill to really improve your smile. That's a big one too. Cosmetic dentists promise us beautiful smiles, a smile makeover, but how do we know if they can deliver? Any dentist can call herself a cosmetic dentist. Here are some questions that will help you select one that is qualified. Number 1, have you had postgraduate training? If so, where? The cosmetic dentistry field has changed rapidly over the years. A dentist with no postgraduate training is not likely to be current with these advancements. Look for postgraduate training in porcelain veneers for well-known schools like LVI Global, the Pankey Institute, and the Scottsdale Center for Dentistry. Number 2, what kind of veneers do you use? The best veneers are either feldspathic super thin veneers or CAD/CAM veneers, which can be milled and made by a computer. Show me the veneers. Tell them to show them to you. They should be able to show you 10 or more before and after photographs or videos. Are willing to give you the names of patients who have consented to be used for references. Be cautious. Some dentists use before and after pictures of models they did not work on. Verify that you're seeing the work is done on actual patients. And that is really, really, really important when it comes to seeing any type of stuff like that. Make sure that they're not just using models for that type of stuff, and make sure that your dentist can actually show you or tell you some sort of information to make sure that they're accredited like they say they are. Number 10, how to avoid the root canal your dentist says you need. Your dentist has just conveyed the dreaded news you need a root canal. Here's the name of the endodontist I recommend. Now what? Endodontists receive at least 2 years of additional training after dental school. They are root canal specialists. Start by checking to be sure the endodontist is licensed in your state. Some endodontists become diplomats of the American Board of Endodontics and are board certified. You can check to see if the endodontics board certified by going to the American Board of Endodontics website. Ask him if he uses a surgical microscope during treatment. These microscopes magnify the tooth approximately 20 times and greatly increase success rates. If they don't use it, find one that does. Once you go to the endodontist, it's almost a foregone conclusion that he'll perform a root canal. This is his business. This is very lucrative, but is it always necessary? So ask him. I don't know. There's all different terms and things in here, but it says root canal is unlikely to be successful if there is not enough tooth structure above the gum line to protect the tooth from coming loose or fracturing after it's been prepared for a crown. If the tooth fails a test, you might be better off with an extraction and an implant, which would likely outlive you. Still not a walk in the park, but far better than enduring the unnecessary root canal. So those are some general guidelines of what you might need to know and some questions that might arm you when you go to the dentist or you're looking for this type of stuff. Ask for qualifications. Ask to make sure that they're certified, they have the technology, they're really definitely schooled and advanced enough to take care of your needs. When it comes to Washington State, there's 3 different types of people that provide dentures. One is a general dentist, which is usually 2 to 3 schools of dentistry. A denturist, which is 2 to 3 years of denture school. And a prosthodontist. That's what I have. I call him my denturist, but he's a prosthodontist, meaning he's a dentist that went to school afterwards for denturism. So he holds all of that. He's like the best guy you can go to in Washington State as a prosthodontist for dentists or for dentures. General dentists don't really like to do dentures in Washington. They rather refer you to a denturist or to a prosthodontist. I go to an office that has a denturist, a prosthodontist, a dentist. They're all under the same roof and they all work together. Mine started out as a Navy dentist way back in the day. But make sure to just check the qualifications of wherever you're going. Denturism is something that's only practiced, I think, in 4 or 5 states: Washington, Oregon, California, Idaho, Montana, and I think Wyoming, so maybe 6. It's not really that big just because of the difference in the schooling and stuff, but a prosthodontist is your best bet for dentures anywhere else. They have 2 to 3 more years of schooling regarding dentures than general dentists do. So anyway, I hope that helps you guys out a bit. I'm going to cut out of here because it's actually getting dark now. So have a great day. I hope that helps you guys just arm yourself with some questions.